Hi, I'm Dr. Brooke Vezino, and I'm a family medicine doctor. I work in Sebastopol at the Sebastopol Community Health Center. So a family doctor is a medical doctor who goes through regular medical school and then extra training focused on family medicine. And family medicine basically is full spectrum care from birth to death. So it can include doing prenatal care for women, as well as contraception, reproductive health, deliver babies. In my training, I delivered about 100 babies. And then taking care of the newborn all the way up to all the well-child exams through 18, and then adults and young women doing all women's health, so pap smears and all that type of stuff, and then all the way through adulthood and even until the elderly, and even up through death, and being a part of hospice and whatever it is that kind of brings the end of life as well. So it depends on where you work. So for me, I work at Sebastopol Community Health Center. So it's one of the, it's a medical clinic that's in Sebastopol. And it is basically, again, it's full spectrum. So it's newborn babies, pregnant people, all the way up to end of life. And so I basically wake up in the morning. We start with what we call a huddle, which is like we get together with myself, my medical assistant, my nurse, and my front office person, and we talk about who all is coming in that day, and think about like what we could do to make the day be a little bit more efficient, or look ahead. Like if somebody needs stitches, then we make sure we have the stitches available and everything to clean. If somebody needs contraception and they want an IUD, then we make sure we have an IUD there, or paperwork to help talk about like what are the risks and the benefits. And then we go ahead and I go ahead and I see patients, and I usually see patients about one every 20 minutes or so. For new patients, it's about we get 30 minutes instead, and see patients from 9 to probably 1-ish, 12:40, and then at lunch. Unfortunately, what it really means is that I work through lunch like every single day, because I could take a lunch, but then I would end up taking more work home, and I'd rather be home with my family when I go home. And so I end up answering phone calls, calling patients, reviewing labs, and all that kind of stuff during the lunch period as I'm eating. And I think that's pretty common for a lot of doctors. It's not a healthy lifestyle, but and then the afternoon, we see patients again from about 1:40 to 5 or so. And then I usually stay for another hour, and then I'll go home. STEM is science, technology, engineering, and math, and so the whole educational process of getting to medicine incorporates learning about a lot of those things. So the basis of medicine is science, obviously, and learning about biology and chemistry, and really even physics. If we think about certain injuries that happen to the body, you need to know about how things twist and turn in motion. And then obviously all biochemistry as well, in terms of all the medicines. I think the social aspects of science are also really important. So looking at psychology and sociology and relationship, because a lot of what makes people be able to be well or get better has to do with not only like what's going on in their body, but the support that they're getting from their family or their friends or their spiritual community, or if they have a mindfulness practice, or are you exercising, and what are you choosing to eat. So nutrition itself is also science. Technology, obviously, I mean, like, depending on, there's lots in medicine, but in terms of my daily work, probably a lot as it comes into play with how people make medicines, and basics of, casting, or I don't know, if somebody needs, one of my patients goes to the cardiologist and they need to have a stent that opens up their heart, then that's a certain medical technology that happens. So it's pretty integrated into, I would say, most everyday aspect of what we're doing. So I am 39 years old, and so it's 2017. So I started residency 11 years ago, and when you graduate medical school and you go to residency, that's when you're officially a doctor. So I guess it's been about 11 years now. My gosh. Schooling is really hard. It's really hard. And it's, I think the hardest part of the schooling, for me, it was not the actual school part, because that was something that I felt like I came more easy to me. But one of the hardest parts is balancing, family and work, actually. But the school part specifically was not memorizing so much information, which is a huge part of it, but trying to get through the residency part. So medical school, you do the first 2 years are like basically like fire hose, take in a lot of information, and then the second 2 years are clinical, meaning that you basically are a doctor in training, and so you work in a hospital, you work in a clinic, and you're learning as you're going with what they call attending physicians helping you. And so that part was really hard, unfortunately, because a lot of the system is a little bit paternalistic and like very like power structured, and so sometimes there would be really great relationships and like mentoring going on, but sometimes because people were really tired and because the system before them was really kind of a little bit rough, that would be the same system that I would experience. And so sometimes people would, talk to you kind of shortly, or there's just like very intense amounts of time that you're expected to be awake and functioning and providing really high care. And so like if you're up for 36 hours and you're trying to like assist in a surgery where you're standing up for 6 hours, like literally like holding retractors, and then you're running down to the ER and you're trying to, help evaluate a person and be emotionally present for someone who's suicidal, or then you're going and somebody is coding, which means that their heart stops, and you're trying to do CPR on them. It's just a really rigorous experience, and so that in itself is hard. And so if sometimes people are also not as kind, then that made it really hard. So that was, I think, the hardest part at times. But I was pretty lucky. I actually had a pretty great medical school and a pretty great residency experience that way. I mean, I think that's the benefit of medical school and residency, is that like you are generally learning things that you're using on a day-to-day basis, even if it's not necessarily directly applicable. So like biochemistry and remembering all those crazy pathways, I'm not like coming up with the Krebs cycle in my head anymore, but at the same time, understanding that on a basic level does get incorporated into when I'm looking at different treatments for different diseases, and that is on a daily basis. And in terms of math, it's really funny. I did calculus and whatnot, and in reality, what I use on a daily basis in terms of math is like basic algebra, and I use it every day. Every single day I use basic algebra because I have to calculate medicines for little kids, and they're all based on weight. So that's something that happens every single day. But I think the most important things that I learned in school actually ended up being not necessarily things that I like memorized about like the body or anatomy or whatnot, which obviously I use every day, but more about like experiences of being with people, and just learning like how to be present with people. And it's just interesting because you would think that it would be all about like the stuff that you memorize, but it's probably more about the relationship. So probably piggybacking off of what I just said, like I think that obviously to be a doctor you need to have intellect, right? And you need to have like a passion for learning things and being excited about some dorky stuff, right? And ideally, you really have to be relationship centered, and I think that's a difference for family doctors specifically, is because you have the opportunity to be part of people's lives, and so and in the privilege as well, and you hear a lot of really hard stuff. I mean, people go through a lot of challenges, and the part that's most important to me and that I think is most important for family doctors is to be able to sit and be present and witness that, and then also help kind of facilitate people's processes to figure out where they want to go. And so much more of that ends up being emotional and mental progress, as opposed to just like the easy stuff is like stitching up a leg or like giving somebody antibiotics or whatever. That's simple. The harder stuff is, helping somebody through the process of grieving somebody's death, or helping somebody through the process of having a history of abuse and figuring out how that's related to their chronic pain, and figuring out how do you then move forward and achieve their goals. And so I think the experience of learning how to be in relationship and be a safe space and help facilitate processes is probably one of the most important parts.